My name is Emily Paisner. I am the Senior Director of Marketing at Daybreak Health, and I really appreciate you all being here to hear directly from district leaders how they're securing funding and grants for essential mental health programs in their school communities. I am joined by an incredible group of panelists and district leaders today who all bring their unique expertise and point of view to this conversation. I'm going to introduce each of them and then we'll get right into the conversation since I know you want to hear from them all. So first, I'd like to introduce Dr. Kimberly Steinke, the Chief Exceptional Children and Student Services Officer at Guilford County Schools in North America. Guilford is one of the largest districts in the country with a student enrollment of around 67,000 students. Dr. Steinke previously served as the interim chief of student services and the assistant superintendent of exceptional children since joining the district in 2020. She has supervised the district's 4 public separate schools for students with special needs, as well as the exceptional children and student services departments, which includes health services, social work, school counseling, mental health, behavioral support, Title IX, and other departments. It's very, very impressive, all of the roles that you have at the district. Prior to Guilford, she served in Polk County and Orange County in Florida. Thank you so much for being here.
Thank you, Emily.
Next, I want to introduce Dr. Adrain Johnson, the superintendent at Hearne ISD, which is a rural district in Texas with about 750 students. He's known for improving student outcomes in districts with underserved student populations, improving the districts to meet and exceed state standards academically, and implementing evidence-based programs to sustain that success. Welcome. Thank you so much for being here, Dr. Johnson. Next, we have Kristen Schmidt, who is the Director of Social Emotional Learning at Crystal Lake Elementary in District 47 in Illinois. Kristen leads the team that supports students' social and emotional well-being to provide the foundation needed for all other learning to occur. She believes that students' academic success can suffer if they are experiencing mental health issues and is committed to providing multi-tiered systems of support to help elementary students and their families. Thank you so much for being here. Lastly, we have Daybreak's grant expert and writer, Cicely Bega, who is here with us today to share some practical tips and advice for tracking and writing school-based mental health grants to secure sustainable funding. She can also be a resource to you and your team, so we will share more about that at the end of this session. It's so essential that we have these different perspectives here today, from a large district to a rural one, to one with a more elementary age population. So again, we're truly lucky to have this team here today. A quick note that we will be recording this and sharing it out with all of you in a few days following the webinar, and we will leave time at the end for any questions. So please ask them in the chat box. If that is not enabled by the time you have a question, just put it into the Q&A section. All right. Let's get started. I'd love for each of our district panelists to first give an overview of your district, your multi-tiered systems of support, and how you're currently funding your mental health programs. And I'd love to start with you, Dr. Steinke.
Great. Thank you, Emily. So here in Guilford County, North Carolina, we have about 68,000 students. Nearly 10,000 of them are students with special needs with IEPs. Our poverty rate is about 66.3%. Children speak 121 different languages, and we have almost 10,000 personnel to support them. We are a large district with 124 schools. We actually have 350 school and office buildings around the county. You can see our demographics there of our population. The majority of our students are Black, followed by white, and then our Hispanic students. We have about 388 buses on the road every day, traveling about 45,000 miles every day to get our children to school. And that covers about 3 acres of land. I'm sorry, 3,000 acres of land. 3 acres would be really small. One of the things that we're most excited about this year as a school system is we have reached, and Emily, you can go to the next slide, reached our highest graduation rate that we've ever had of 92.2% from last year. So we're really celebrating that. And That's just a little bit about Guilford County. Thank you. When I talk about some of the other things, though, about our district, I forgot. The district priorities that we have coming down from our superintendent and our leadership, we are on a 5-year strategic direction, specifically with 4 priorities. First one is to accelerate learning. So that's a lot of our academic work. We have a focus on recruiting and rewarding top talent, which of course is our personnel, getting them and keeping them. We have a very specific focus on preparing students for the world. So there are a lot of companies and community people that help us with a lot of programs, CTE, the whole 9 yards. Boom Sonic is coming here. There's a Toyota plant being built. Publix just built a operations center as well. So there's a lot of industries coming into Guilford County that is helping with all of that. And then our 4th priority is specific to a solid commitment to strengthen the health, wellness, and safety in our schools. And that's where a lot of the specific work with our mental health lives. So removing barriers to students and families and accessing the care that they need, whether it's mental health, physical health, behavioral health, any of those things, is a critical component in our district's vision for the health and wellness of our students. Our academics division works very specifically with my Exceptional Children and Student Services division to ensure that an MTSS structure is in place, which aligns specifically with our school improvement framework. So when our schools are working on our principals are working on their school improvement plans, they build in and describe their approach to improvement, including the tiers and supports that they provide. And then simultaneous to that, our district level team members between academics and my division provide direct support to the schools when implementing that structure so that they can ensure that everything from providing interventions and services to students, to sitting alongside teachers and PLCs, to conferencing with school leaders when they're problem solving tough situations that they deal with regularly. That's how we implement a very strong multi-tiered system. And we're still working on it. There's still a lot of work going into that and aligning what we do with our schools. As a part of our district strategic direction under Dr. Oakley, our superintendent, under her direction, we transitioned to a zone support model this past in 23-24. And in that zone support, we have 2 principal supervisors that support a feeder pattern of elementary, middle, and high schools. So together, those 2 principal supervisors will have between 20 and 25 schools each. There's 5 feeder pattern zones, and then we have a 6th zone that is just made up of specialty schools, so our 4 public separate special needs schools, some early middle colleges, and some alternative programs are in that 6th zone. And then that zone structure is supported by a district level team of representatives from all of departments, whether it's my division, academics, facilities, HR, technology. They have a team that supports that feeder pattern of schools and the work that they do to anything that goes on at the school. That's the team that they go to. Those teams meet twice monthly, and it's really allowed our principal supervisors to have more direct access to the district team members that work to support their schools. So it's proven to be very beneficial in that. When it comes to our funding of our mental health work, we have a combination of our local funds that comes from our county commissioners, state funding, of course, from the state of North Carolina, and then federal funding that we have used and established a really robust program to provide mental health services across the district. First, our mental health department includes a mental health director and a team of leads who partner with each of their assigned schools to ensure that mental health referrals for students are processed in a timely manner and routed to the appropriate level of service. So whether a student needs something through Daybreak, which is a virtual platform that we use, or a face-to-face, or an in-house, a social worker that they have already at their campus, or a school site, they kind of determine how that is routed for the student. And then that's our internal services. And then through the U.S. Department of Education, we've secured 2 very substantial grants over the last few years that are specific to the provision of mental health services. The first one is our school-based mental health grant, which is $14.8 million, an additional 3 point something from us that we match with it for over 5 years, with the focus on the direct provision of mental health services to students and a direct work with increasing our internal clinician staff and the capacity to provide services. So our school social workers, our counselors, all of our special instructional support personnel, building up their capacity as well as bringing on new clinicians. And Daybreak has been an excellent partner in that work and in doing that. So we appreciate that. Our other grant is our SAMHSA grant, which is $3.8 million over 4 years. And in that, we're focusing on 6 pilot schools, which is 2 elementary, 2 middle, and 2 high schools in their feeder pattern, with a focus on intensive trauma-informed mental health services and also a continuum of care for students and their families, as well as a focus on destigmatizing mental health disorders. So we're getting that off the ground this year. And I think that's everything. Thank you.
Thank you so much for that comprehensive overview. I know we're going to dig more into the funding and appreciate you talking about, the local, state, and federal grants. And, clearly you have a big and robust team behind you. So I'd love to hear from Dr. Johnson now a little bit about Hearne and, an overview of the work that you do there. Oh, you're on mute, Dr. Johnson.
I knew I was going to do that. Thank you, Emily, and to the distinguished panel. It's an honor to be sitting here amongst you all and to the guests that are coming to us from all across the nation. Hearne ISD, Hearne, Texas, is known as the Crossroads of Texas. It's a small rural school district, not very far from the Texas A&M University area, Bryan College Station. It's kind of one of the centerpieces of Texas. And like I said, it's known actually as the Crossroads of Texas. So many of the major highways and railroads come through this area. This is a relatively small district. Our membership fluctuates between 700 to 900 students each year. I call this one of the smallest, most high-profile districts in the state because when I came here 8 years ago, this district was struggling with the accountability system and was very on the brink of being taken over by the state, and other options such as closure were on the table. But we managed to convince the state to let us stay open, and we've done a lot of work to try to get things turned around. But me personally and professionally, I've had experience in large districts as well as small districts and have worked actually for the State Department. So I can tell you size really doesn't matter when it comes to the challenges we face with kids, because once they walk in that classroom, it's generally going to be 1 to 10, 1 to 15, 1 to 20, and sometimes in some cases one-on-one to help these children. And so as I looked at this district and throughout my career, I felt it was so important to have strong counseling programs. I've been in districts where we even had social workers before. And unfortunately, but fortunately, because we went through the pandemic, or was going through the pandemic, and the federal government and state started helping us out with funding, one of the first things that we did when we started getting this funding is looking at positions that could help us help children and families get through this system. So we looked out and found us registered nurses that could come and work for us, a registered nurse to come and work for us. We for a small rural school to have 2 social workers in the district was unheard of. But it was so important. And we knew then that funding was going to be a challenge, but we wanted to do what was right for children at that time, because I knew they needed it. And there's another group that needs it just as much, and that is the staff and the families along with this as well, because I think we're still reeling from some of the challenges coming out of that pandemic. And so we knew it was going to be a challenge, but we were up to the challenge. And our district is 95 plus economically disadvantaged. Now, I like to call it economically challenged, but the state and federal government calls it ED, economically disadvantaged. And that is a pretty significant number when you think about a classroom with probably 100% of those students in that classroom are economically challenged by the situation that them and their families are living in. And so when you couple that with the challenges in trying to be effective as far as educating all children to a high level, and our demographics is predominantly Black and brown. We're about 90% African-American Hispanic students in our district. So it gives you a good picture of how we look, but the challenges are so great for so many of our families. And when we came along with the idea of doing more work to help support the family and creating our multi-tier system, first thing we did to help with the academic is we created a foundation called the Hearne Education Foundation. And this is a foundation that is compiled of 4 professors from the University of Texas A&M University, 2 staff members from larger districts in the state that serve on our board, as well as other individuals from other universities, as well as individuals in the community with our regular traditional board are part of this system. And this brought really a broader perspective to what we need to do and increased our ability to partner with other groups. And that led to this partnership that we're actually talking about here today. So we have academic support coming from many different partners that we have, including our Hearne Education Foundation. We have multiple programs coming out of Texas A&M University, Prairie View A&M University, as well as some of the leaders in the state in education from some of the larger districts that we work with, Cy-Fair ISD and Longview ISD. They are phenomenal districts that take the time to work with our staff and our students to help us get to the next level. And then, of course, there's the mental health counseling that's part of our process, and certainly increasing our counseling program and adding the social workers to that program was really important in developing a strong tier system. As in addition to, we have a mobile unit, health unit, that comes out of the A&M program as well, that comes here once a week just to do health checks on kids and families and staff and anybody that you need it. So every Friday, you know that there's going to be a mobile unit here that can help you with areas outside of the mental health challenges you might be needing. But then all of a sudden, the pandemic is over with, and we knew the money was going to get tight. And unfortunately, one of the reasons why we didn't have social workers here prior and counselors as many as we want and nurses is because you can't compete with the other larger markets. So just as we knew we would probably lose some, then we gained this opportunity with Daybreak to come in because of a grant. I know we'll get into the funding a little bit later, and we'll talk more about that. And so that allowed us to keep that major tier in our system in place. And that's just been a true blessing for us to continue this. And then what the framework that Daybreak is bringing to us, it is already helping our system be more proactive and less reactive. And so I'm really excited about the partnerships that we have. I'm really excited about learning more about how Daybreak can impact us, and it's already showing up in what is happening in our district. Unfortunately, today is a tough day for me and for our district because we actually are closed today because we have had what I would call a student to have a mental breakdown. And hopefully we can help him get himself back on track and not do the things that they were doing and saying the things they're saying that create the concerns that we have for our students. So we're hopeful now that because of the system we have in place, we get on this situation early, and we're working with it with local law enforcement to get things resolved and hopefully get the right counseling support for all of our students moving forward. So I'm glad to be here today to share this important message with you all and have a good discussion and learn more about what's happening around the country.
Thank you so much, Dr. Johnson. And I shared this in the chat, but, thank you for sharing that with us. And, it's a very, very sad reality of what you are all dealing with every day. And just please know that we're all thinking about you and your community right now during this time.
Thank you.
Kristen, over to you.
Hi there. So I am in Crystal Lake, Illinois, which is an urban suburb of Chicago. And I'm probably right in the middle of the other 2 districts as they were sharing some statistics. We have 12 schools. We're an elementary district, pre-K through 8. And we have about 60 languages last I checked. We are a pretty diverse population, but there's a wide breadth to our diversity because we have absolutely the haves and then the have-nots. So it makes it sometimes a different type of challenge because you're trying to make sure that you reach both ends of the spectrum because there's problems no matter what, but they sometimes look different. And we typically have somewhere between 7,000 and 8,000 students. So we also were fortunate to get the school-based mental health grant. And for people who are familiar with that grant really is to add mental health staff to your to your district, right? And to be able to add humans, where I think a lot of us who've been in education understand that in the past, a lot of times the grants are there and people are buying curriculums or items or things like that, even professional development, where this is very much human focused. Daybreak allowed us to use some of that funding to be able to provide an additional layer to the staffing that we were able to increase. From my vantage point, I'm a social worker by trade, and I did many years in special ed. I feel like I'm a little bit different in the leadership community because I'm a therapist and I'm not a teacher. So I try to bring that mental health lens into every conversation and that idea of the whole child. And so with our grant, we were able to add my position, which, I think should be something that is in almost all districts. I think it should not be the abnorm nowadays when we talk about mental health and social emotional learning and behavioral health and all of those things. We should have someone who's spearheading that. And the larger districts, I think you might see that, but most districts that hasn't become a total norm yet. So I'm hopeful that that will happen in upcoming years. But we do have an MTSS process like most districts and have the multi-tiers. What I think that we're trying to do is to be able to add additional layers into those tiers, because I think what we've learned is that it's much more complex than just providing 3 layers of support and thinking that will address all of the issues that are coming before us and coming into our classrooms. And so we're working on being able to do more of that and much more proactively, because as a mental health person, I definitely believe that if we can get supports and services in place early, we don't need to talk about disabilities and special education services and things like that. But historically, districts have struggled with being able to have the staffing available to do those early interventions because they have such a high caseload or workload just to handle the things around special ed. So we were grateful to receive this grant because it allowed us to really focus on that proactivity. And so with that, Daybreak has given us the opportunity to be able to not only have the person in the school working and supporting the student and the family, but then giving that additional layer to our students who have the most intensive needs. I think for us, our goal, and I know we'll talk about funding, but our goal with Daybreak and anything else is to make sure that we're demonstrating the effectiveness of the positions and the supports through data, right? So we need to all be thinking from the moment that we receive any grant that we are taking data and looking at data to talk about how students are impacted by the additional supports and services that we're providing. And with that, that leads to different kinds of conversations as time goes on. So I think that's something that we're really focusing on. I think what we're trying to do in our community is to talk about how there are so many different partnerships that we can have, and Daybreak for sure is one of them. We also partner with our local mental health board, and we make sure that we get together quarterly with all of the districts in the county, along with the providers in the county, so that we can be sitting together talking about the needs of our community and what pieces and parts of those needs can be met by different agencies, providers, and district personnel, right? Because it's much more complex than it used to be, and it's nowhere near as black and white as they are in school, they get this, they're out of school, they get something else. We really have to partner more, and if we're not in the room together talking about what those needs are and those barriers that we all experience in our own industries, then we're not able to be as effective as we could be by coming up with solutions. So that's been something that's happened in recent years that I think has really led us to come up with some pretty unique out of the box ideas with how we're going to continue to provide those layered mental health supports to our students. For us, as I was hearing Dr. Steinke talk about like strategic plan and whatnot, we are embarking on our new strategic planning committee. It actually starts next week. And I anticipate that behavioral health and mental health and SEL and all of those things will be definitely huge in the conversation, no matter who's speaking around what we're going to do and what that will look like. So I'm excited that I feel like we've kind of gotten a jump start on that through this grant funding and the other work that we've been doing over the last few years. And that will allow us to really talk about how we can impact student performance and other student data points through this work with school-based mental health. So for us, I think we're just excited to be at somewhat of the starting pieces of some of this, and really then transitioning to deeper level embodiment of mental health in the way that we're functioning day to day in our classrooms. And that's what I got for now, Emily.
Thank you so much. I loved hearing from you about, how your whole community comes together to talk about, the mental health needs that you're seeing and the trends. It's just, I love that, more holistic community approach. And Dr. Johnson, I was going to direct this next question to you, but anyone, please feel free to chime in. Obviously, the grant landscape has changed quite a bit over the past few years. And I'm sure even more so from when you started your careers in education. So how has, working with grants and securing grant funding fundamentally shifted, and what advice would you have for folks who are trying to secure that funding? Oh, sorry, you're on mute again.
One of these days, I'm going to do that without being reminded to do that. That's my goal. So give me one more question before this is over with. Yes, 40 plus years in this business, and certainly have been through many opportunities. I'm not a grant writer, but I call myself a grant getter. And I know people who can write the grants, and I try to find the good ones that will come along and be a benefit. And I always looked at grants as the incubator, programs that you can start and get real creative with, and hopefully become eventually a part of your system. Unfortunately, many great programs come and go, and people say, well, what happened to that program? And well, the money ran out. And that's the difficulty that we all face. But what we try to do is try to do things, and then I think that's what's going to work better for us in this partnership with Daybreak, is to be able to continue some components of this even when the funding gets difficult. And hopefully we're getting ready to start a legislative session here in Texas, and we were looking at school funding being one of the top priorities in the state. And one of the things that I've always testified to and say to the state legislature, there's 3 areas we really need to focus on. And one is certainly the pay for our outstanding teachers and staff. And the second is the more funding for the mental health and support of our students and staff. And then, of course, school safety. So those are the things that I see as priorities. And sometimes they do use grants to just get things to see how they're working. We got quite a few grants this past year for school safety. And of course, the Strong Connections grant, which has really helped us create this partnership with Daybreak, came along as well. But what we're trying to do is, now that we've seen how effective having social workers working along with counselors in our system, even though we are small, our needs are great. And it is paying big dividends when you can help these families improve their lot in life by helping them get to the resources that many of them could already be a part of, but they just didn't have access to it, or they didn't know about it. But having the social worker framework set around this, and the Daybreak support system in place for these students, so they can get almost free healthcare and free counseling off their phone, or hopefully even in person, is a tremendous asset. And right now, that's a grant, regardless grant or in-house funding. I'm not going to let go of that very easily. And so we'll find other ways that we have to cut and do things. And hopefully the state will come around and help support us, where we can literally have our cake and eat it too, with having this strong, robust support system in place, and working with partnerships from Daybreak to Texas A&M to major universities and school districts in this area, and keep this going. We just really can't go back. And what we learned from the pandemic, and from that time that we were able to help students to get one-to-one with electronic devices, help students to have additional support system in place, we can't let that go. So I think as a district, and as a region, as a state, and then as a nation, hopefully some of the results of these programs can go out and show our leaders, especially when it comes to funding, how important these programs are. When we're looking at what we're spending in some areas of our society, whether it's the correctional institutions or the support systems out there to help these families that are breaking down. If we spend more of that money up front through public education, then will be less money spent on the other areas of the prison system and the healthcare system being overloaded because we're not getting to these students, and even the safety of our students can be impacted by having a strong support system for these students and to get them the assistance and help that they need.
Thank you so much. Kristen and Dr. Steinke, feel free to add anything in if you'd like.
Emily, the only thing I would add is I think one of the things that's changed in the last, actually it's more than 2-3 years, maybe 5 to 6 years, is you have to be strategic about the grants that you're applying for, because there can be a lot of overlap. So you've got school safety grants, you've got mental health grants, you've got some that are MTSS structured. And as you look at those and look at opportunities, it's important to kind of know what their the niche is for the grant and what your needs are, so that you can be very strategic about what you apply for, how they overlap, where the funding starts, where it ends, and your timing. Also, just about the personnel that you're going to need to manage the grant, because that can be something that you can get a whole bunch of money, but if you don't have the people that know how to manage it, know how to manage a budget, understand the work that's specific to that grant, I think you can get sidestepped with that and lose out on money that your students and families need.
Love that. That's really helpful, practical advice. Dr. Steinke, I'm going to stick with you here for a second. I think Dr. Johnson spoke to this, that, grants can be short term, right? And so a lot of districts may be hesitant to apply for them because they think, this is only going to sustain this program for a certain amount of time. So how in your district at Guilford County Schools are you thinking about the sustainability of these programs, and more specifically, the financial sustainability of these programs?
Well, I mean, like you said, implementing services or a program with funding that is going to be short term and not going to last for several years is hard. And so making the decision to even apply for it in the first place, can be a challenge if you're only going to have it for 3 years. But that doesn't necessarily change the need for the programs right now. I mean, the need doesn't go away. So I've always been of the philosophy that you just continually apply for grants as much as possible. Even if you apply for something and you don't get it the first time, turn around the next cycle it opens up, apply for it again. A lot of the systems that offer grants, whether it's federal or private or endowment funds here or there, they'll give you feedback on your applications and what stopped you from getting something. So always take that information at hand and improve your grant application the next time around. Thankfully, GCS has really experienced success with our school-based mental health grant, and I know I'm seeing in the chat a lot of people have received that grant across the country. But because of the success, it just further demonstrate the extensive needs for the services and the funding to support it. Our community members, our local philanthropists, they see the need. We're internally hoping that the US DOE will continue to offer these grants in the future. I think they will. The need's not going away. They see that as well. But in the meantime, one of the major discussion points in our state of North Carolina, and I'm sure probably in others, is the availability of increased Medicaid funding to support the needs of our district. Every district I've ever been in, we have really focused on using Medicaid billing and funding as a funding stream and a strategy. Max out what you can earn and set a baseline of what you think you can maintain every year. Don't overspend or overplan, but that's definitely an avenue that I know a lot of places, and specifically North Carolina at the state level, they're looking at definitely taking advantage of any and all opportunities available under Medicaid for the future.
Absolutely. I know, several districts that we work with is, a funding model where, schools are paying for some of the costs, but we partner with a lot of insurance companies and Medicaid as well to help cover those costs. So definitely important to have, various funding streams for these programs. And, you talked about applying for grants as much as possible. And I can appreciate that Guilford is a big district with probably more resources than some others. And so, Kristen, I want to sort of dig into that with you, and talk about what are some challenging and difficult parts about the grant process that you've encountered, and where do you wish that you and your team could have more support to continue to apply and secure these grants.
Yeah, I think you nailed it on the head, right? Because we don't have grant writers or positions with grant writing embedded in it. So I think that's what makes it challenging. So if we're getting grants, it's because somebody is passionate about something. For me, I think there's two parts that are difficult. Like, we were lucky enough, yes, to get the school-based mental health grant. We partnered with our PBIS regional support network, and they had someone who was very proficient in grant writing. So I was able to do that alongside her. And I unequivocally say that I would not have been able to secure that grant on my own, because she knew all of those nuances. As you know, my panelists kind of reference, like, you have to know some of that in the language that you're using, and just what they're really looking for, and maybe the messages be in between the direct things that are being said on the grant app, like all of these nuances. So she was able to do that, which was amazing and helped us tremendously. So I think, like, investing in grant writing professional development in districts is great, and embedding grant writing into certain positions. And while that is an additional job task, I understand that. And you may even be adding a position or something like that. I think it very much would be worth its weight in gold if you're able to then to secure funding on the other side. But you have to invest in people getting that really specialized skill set. And I don't think that happens very often in education. We don't have that kind of background or educational opportunities, no matter what kind of track you've taken in education, for the most part. I also think then, for me, like, yes, we were lucky to get the school-based mental health grant, but the reporting aspects of it, that was brand new to me. And that was a huge uphill battle for me to learn. I joke all the time, right? I'm a social worker, and I'm like, let's talk about how we feel about it. Like, it's real hard sometimes to think about how they want to quantify everything, and how I'm supposed to articulate the data. And then they're using, obviously this is an educationally based grant, but they're using a million different acronyms, half of which I hadn't even heard of before. And I come from special ed, so that's saying something. But I think even that, like, having that kind of support at the district level, because there's doing that well at the front end is going to help with what Dr. Johnson said, by being able to make the case for why districts should absorb some of those costs, or why they should pursue additional funding sources to continue with those programs and services, supports, whatever, that are embedded in what you're doing with that particular grant. But if we don't do it right from the beginning, it's going to absolutely end when the grant funds are done, because we're not going to have done the front end work, and then throughout the time period of whatever that grant is providing. So I think there's a lot of professional development opportunities to be had for districts to make it easier. And I think there's stuff out there, but I think it needs to be more readily available and better communicated to educators, so that we can have teams who are able to do that. So, like, in my district, we have a behavior coach team of 4 individuals that come from general ed and special ed, and they have a comprehensive program. They're able to go into buildings and classrooms, support individual students, support teachers, and then do professional development. And what I'm working on is getting them some of that professional development embedded into those positions, so that I, alongside them, can get some better knowledge and understanding of grant writing, so we can look at other grants that are out there. The only other thing I would say, as far as a difficulty, is I don't know that a lot of people even know where to look for a grant. So to me, it's like, Google's a pretty big place. I don't know, so if you don't hear of things, or you don't know people who are going to tell you where to look, I think that can be really difficult. So it would be wonderful to see that there's a better communication trajectory for those things for people who do want to know. And then you can look at your team and decide who maybe are the best players on your team to be able to help secure those grant opportunities.
So I promise we're going to get to our grant expert, Cicely, in a minute. And she actually has been working on a resource for all of you to be able to go to that she updates every day, frankly. Like she's always looking for new grants that are coming out. And so we're going to share that with all of you in 1 second. But before we get there, you were talking about, hiring and you said it was worth its weight in gold to have someone who is focused on that. And Dr. Steinke, I know your district did this. Can you talk about the position that you specifically developed for this?
Sure. And like Kristen was saying, I mean, having the right people investing in this is huge. None of us that went through school to be educators in whatever shape or form that is, we go through budget training, even as administrators, we go through budget training, but it's never at the level of intensity that grants require. And the federal reporting requirements are huge and hard. And so I've been blessed personally in the districts that I've worked in to learn from people that know how to manage those kinds of budgets and things. Um, so that's helped. But coming into Guilford, what our superintendent did, and it's been great, is we developed a specific position. She's called the Senior Director of Public Affairs and Philanthropy, and she is specifically responsible for facilitating all grant applications and philanthropy efforts across our district. So she monitors the Federal Register, any other resources, so that anytime a grant becomes available, those of us, we're notified if the content of the grant falls within our area of work. And then she also helps and guides the team and kind of facilitates the completion of the application. We're our content experts, so we know what it means to say, mental health from a social worker versus from a school psychologist, and how that can be the same or be different. She doesn't have that base of knowledge, but she learns it as she helps us with the grant application. She's great because she serves as the conduit to the superintendent's office. So anytime a grant comes up that we want to pursue, she gets our feedback and everything on how it could work, and then she takes it to the superintendent. Superintendent approves us applying for it, and then we go through the remainder of the superintendent's office. But she also makes sure that we meet grant deadlines, that all the signatures that are needed are there, any reporting timelines that have to be met. She reminds us of those. We recently actually ended up closing out a grant. We were in our final year of extension of it, so we were spending out the rest of the money, and she helped guide that along. She connects us with the finance department for those things. So with all that under that direction and our superintendent, we've really committed specifically to finding and allocating funding for our mental health services and programs, and just everything else beyond that too. It's been great.
That's wonderful.
We're blessed.
I do have some more questions for the district panelists, but I want to quickly shift over to Cicely, who is Daybreak's in-house expert on all things grants. And so I'd love, Cicely, for you to talk about how you've partnered with districts to help them apply for grant funding, and how you support the ongoing tracking of grants, which we will share out. So just let me know when you want me to pull that up.
Great. Thanks for having me, Emily. I'm so excited to be here today and to learn from everybody on the panel and help share a lot of this great information. As we've mentioned, at Daybreak, we're at the intersection of mental health care and education, and we truly understand the funding challenges that districts, as well as the complexity of healthcare finance. As experts in this intersection, we're always creating opportunities for districts to partner with us by maximizing limited available funding without limiting access to care. One way we do this, as you mentioned, is by billing and collecting from insurance companies to reduce costs to districts. And another way is by searching for alternative funding sources such as grants. I'm excited to be here today to talk about grant support that Daybreak is providing for districts. And first, thank you. I'd like to show everybody Daybreak's grant tracker. This is linked on our website and is updated often. We know that districts are busy being educators, and not all districts have a large grant team to source grants, as we've heard here today. This tracker highlights grants that many of us are aware of through SAMHSA or Department of Education, but it also has some grants that are more local and specific to states and specific areas. As we all know, timelines for grants can vary. So you'll see grants on the tracker that only fund once or twice a year, where it can take several months for approval. Other grants, such as foundation grants, may review applications all year and fund faster. We try to provide some variety in grant type and timeline. I add to and update this tracker a few times each week, so I do recommend bookmarking it. We're starting to see a lot of new grant opportunities popping back up now that school is up and running. And in just a few months, some of the larger national grants will be posting applications for the next funding cycle. So be sure to check back often for those. You'll see that these are at the top of the grant tracker because all states are eligible for them. If you don't see open opportunities in your state section, be sure to check that top section because that's where the national listings are. Clearly, this tracker is not an exhaustive search. So if you're interested in grant funding for Daybreak services, but you don't see a grant that is a good fit for your district, reach out to us. We can meet and discuss your district's needs and goals. And using this information and some demographics, I will get to work on a more custom detailed search that is a more specific fit for your district. Once we've identified a grant, I'm able to work alongside the district to draft the content needed for the application. And then the district or the district's education foundation, depending on the grant, submits the application. And as mentioned here today, all the talk about reporting and maintaining once you've received a grant. So if a grant is awarded, I continue to monitor the reporting requirements and deadlines and make sure your Daybreak account manager is aware of any service data that you're going to need for grant reporting. Sometimes we're able to build in specific data points that are needed to align with grant goals as well. So I'm looking forward to exploring this with more districts to bring Daybreak services to kids. And just be sure to contact us if you'd like to know more about this. And we're happy to do this work and try to help fill some of these funding gaps.
Thank you so much, Cicely. I just shared in the chat where folks can access the grant tracker. Again, feel free, afterwards to reach out to us to talk specifically about your district, but we do try and keep this up to date. Dr. Johnson, I'd love to hear from you again on any other, processes or systems that you've been put into place, again, coming from a smaller district perspective to, try and secure grant funding.
Yes, and I remember to unmute this time, so give me a thumbs up for that. One of the things for small districts I'm discovering, and Cicely may can help me out, in some grants, is actually you have an advantage if you partner with others. And in some cases, even with other school districts. For example, we have the federal 21st Century Grant, which gives our students at no cost after school program, which is enrichment and tutoring and fun activities that you see in many suburban and urban school districts that are available because of this grant. But we partner with another school district. So actually 2 schools in this area benefited from that grant. We're the larger school, so we are the grant keeper, but we included them in the grant as well. And so I think those kind of opportunities really lean favorable towards small schools, and the experts in the grant field can tell you sometimes you get more points when you're looking at partnering and they know the grant money is reaching more students than just your population. And we've been very successful in operating that program for the last 3, well, this is the 4th year we've been operating that program. Also on that same line, for small schools, we have a cooperative where in this county that I live in, or that I'm working in Robertson County, there's 5 other school districts. And if you put all of us together, we wouldn't be as large as Kristen's elementary program. It wouldn't even be that large, and certainly not even close to what Kimberly represents. But when it comes to special needs and special programs, we cooperate collectively and do funding collectively to service more students. So we have more LSSPs in the county. We have more of the special trained individuals, from speech pathologists to other areas of special needs, that is hard for our district to carry that type of expertise on their own. And so by coming together in our cooperative and partnerships, we're able to reach more students effectively, efficiently, and able to afford these programs as we move forward. So that would be one of the things that I would, and it's not rocket science. I know a lot of schools are already doing it, but it really has paid huge dividends. And I think we can do more of this if we just forget about who we playing on Friday night and the rivalries, and do what's best for children, for all of our kids, and have a common accord to work together to bring as much funding together collectively. And then that makes you have the possibility of longer sustainability of these funds.
Such a key and important point. Thank you so much for calling that out. I'd like to open it up for questions, and also ask the panelists if there's anything that you wanted to add, that a question I may not have asked, please chime in with that as well. So we'll give a few seconds here for people to enter in any questions they might have. And Kristen, did you want to share something?
Yeah, I think what I just want to tell people is, because, I'm thinking, if I was someone who was attending this, what would I want to know? Yes, I would want to know a lot of these nuanced differences, but more than anything, I would want to know there are funding opportunities. So I think it's easy to get stuck. It's easy to get overwhelmed. It's easy to get disappointed, right? And we're in the business of kids, and they're coming in and out of our doors no matter what else is going on. So I think it's important to know there are ways to find funding. And even if it's not grant writing per se, sometimes it's partnering with a nonprofit that's nearby or within your community that's able to access grant funding for other things. So for instance, in my district, we saw an uptick in our middle schoolers bringing vapes to school, and vapes with THC. And, historically, that's a disciplinary kind of thing. I'm a big believer that you don't send a 13-year-old home for suspension for using a vape so then they can vape all day. That seems counterintuitive to me. So because of that, I kind of reached out to contacts I have in our community, and there was a teen center that was willing to pilot the idea of doing an educationally based program on their site for kids in lieu of suspension. And then there was a parent component to that, and it was a very successful program. And then they were able to find grant funds to be able to provide that program. And then now we have it full and ongoing and robust for our middle schoolers, right? So it was a very out of the box way to think about it. And the funding sources wouldn't have been available to me in a district, but they were in availability to partner with us as a district to address a behavioral health need. So I just think people need to make those connections and have those conversations, because there's a lot of information and opportunity out there that we don't realize if we're not initiating those things.
I love the creativity and out of the box thinking, and thank you for being innovative in your approaches. Thank you, everyone, so much for being here today. We so appreciate your time. Dr. Johnson, again, please know that we are all thinking of you and your community right now. We appreciate the different perspectives that you've all brought to this conversation. Feel free to reach out to me directly if you have any questions, and you all have the opportunity to meet with Cicely and a member of the Daybreak team to help you write some of these grants. So there will be a survey that pops up when you close out, and you can let us know that you would like to talk more about grant opportunities in your districts. Thank you, Dr. Steinke, Dr. Johnson, and Kristen, again, for bringing your different perspectives from different states, from different, size schools to this conversation. We truly appreciate you.